Today's episode, we're going to talk about the airlines and the CDC and the updated recommendations that we just received from the CDC. So a letter was written from Delta Airlines to the CDC on December 21st, 2021. Remember that date. And the letter basically was written to the director of the CDC, and they're asking the CDC to reconsider the current guidelines for 10 days of isolation, and they want that to be dropped. They also point out that 90% of their workforce are fully vaccinated, even though a lot of them are calling out, right? So they want the guideline they say we propose a 5-day isolation from symptom of onset for those who experience a breakthrough infection, even though they know Omicron is 25 to 50% more contagious, but they're saying that it's a mild disease for people who are fully vaccinated. Of course, this was written and sent by the CEO, the SVP, Chief Health Officer, and the medical advisor. And then they go on to say, we look forward to continuing our partnership with the CDC to protect the health and safety of our people, customers, and communities as the pandemic evolves. Yeah. So then the Airlines from America also wrote a letter on December 23rd to the CDC, and it looks very familiar. They also say that they would like the CDC to reevaluate the current guidelines and drop it from 10 days to, what do you know, 5 days as well. And they also have the same language that says, they know Omicron is 25 to 50% more contagious, but it's milder. And of course, they value and appreciate the working partnership with the CDC and look forward to their continued work. And this was sent by Nicholas E. Callio, who is the director, and this is for the organization that works with all of the airlines. So then on December 27th, the CDC updates and shortens the isolation and quarantine period. They say that, they've looked at the science and they're going to shorten the recommended time for isolation from 10 days to 5 days. This is, motivated by science. And that, even though people get sick, it's not as bad. And people who test positive should isolate. You know what? We are totally over it. And it immediately received a swift response from physicians. Dr. Andrew Goldstein, who's a primary care physician, said the new CDC isolation guidance seems to be a top-down, corporate-driven, poorly coordinated decision. Number one, Delta Airlines asked for this. 2, CDC staff I spoke with wasn't aware of this guidance change until it dropped, says staff is now being asked to write scientific justification. 3, Delta ask included testing. The CDC guidance doesn't include it. White House cherry-picked health experts celebrating this guidance. But, they're all wishing they included the testing. So the questions he has is, was testing dropped in haste? Was it improper drafting? And is this because there's testing scarcity? There are so many questions, so many issues with this, but the CDC right now is like,
that ain't got nothing to do with me.
Well, my 3-minute break is up. I got to get back to writing, but this is my take on a daily issue. And if there's anything you want me to cover, leave a comment below and let me know. I will be more than happy to take another break to discuss it. But please subscribe to my channel, and I'm also on Patreon. So if you feel so inclined, I would love your support. That's all for now. Talk to you later. Bye.